We're taking a look at the top risk factors for heart disease in women. We're joined by Dr. Simone Bailey-Brown from Rochester Regional Health this morning. And welcome to town. I know it's been just a few months that you've been to Rochester, New York. It came from Rochester, Minnesota, right?
That's right. Thank you. Thank you for having me.
Well, nice that you're here. And I'm glad you're talking about this because women, we take care of everybody else, right?
We do.
We're not always good at saying, I wonder how I am. We need to do more of that, don't we?
Absolutely. And you know, for a long time, people have thought of heart disease as a man's disease. But the truth is that heart disease is still the leading cause of death in women.
Really?
In fact, it accounts for about 1 in every 4 female deaths, which is quite striking.
That is striking. So when we talk, so heart issues, what are some of the things that we typically think of, heart disease that, might be a problem for people?
So, as a matter of fact, about 1 in 2 Americans in general over the age of 20 have some kind of cardiovascular disease.
Okay.
So we're talking there about things like high blood pressure, stroke, heart failure, and also coronary disease, which includes having a heart attack or having needed a stent in the past. Other heart-related issues that affect women are heart rhythm problems, primarily things like atrial fibrillation, which is pretty common in women too.
Okay. How do you describe the symptoms of that? Like a butterfly feeling in your heart? And when do we know, okay, that wasn't just like maybe gas from lunch, like this might be a problem? How do we know when to pick up the phone and say, I need to come see you?
Well, the truth is some women have absolutely no symptoms at all,
really?
As in no fluttering, no palpitations, but many women do have those palpitations, that sort of fluttery feeling in their chest. They most commonly would notice those symptoms when they are at rest and more aware. So many times it's felt at night when you're lying in bed, but many do not have any symptoms, and it's just found coincidentally when an EKG, a heart rhythm strip, is done for another reason. For another reason,
okay. I was going to ask, we should have our physical once a year. Are these things that we should be talking about with our primary care physician?
Absolutely. We definitely should have at least a yearly physical where we get our blood pressures checked, blood cholesterol checked, blood sugar checked, and have an EKG, electrocardiogram, done.
Okay, so that should be a part of the physical?
Yes.
Okay,
yes,
so if not, maybe ask for it.
Yes,
okay.
That's right.
Sometimes we know we maybe carry around too much stress. Sometimes we know we maybe carry around too much weight. We need to do things about that, don't we?
Absolutely. So, when we think about risk factors for heart disease, we can think about them in 2 big buckets, okay? So first we have the risk factors that we really have no control over, right? So things like our age, our family history, and our gender. Can't do anything about that.
No.
But then you have the risk factors that you can do something about. Things like, for example, smoking, number 1. Then your weight.
You just gave me that look, smoking. You're like, why? Why would anyone do that?
That's right. Weight, being overweight, being inactive, eating the wrong kinds of food, so poor diet, and then things like high blood pressure, diabetes, and high cholesterol. Those are all major risk factors. But there are many emerging risk factors that we are a lot more aware of now.
Really?
For example, hypertensive disorders in pregnancy, such as preeclampsia, as well as autoimmune disorders like lupus and rheumatoid arthritis, which occur more commonly in women and have been related to an increased risk of heart disease.
All right, so preeclampsia often in women who are pregnant. If you had that when you were pregnant, is it something that might stay with you as a risk factor later on?
Absolutely. So that has been shown that preeclampsia and other disorders where the blood pressure is high in pregnancy are associated with an increased risk of cardiovascular disease, so strokes and heart attacks in the future.
Okay, you mentioned exercise. Again, women take care of everybody else. Is it just, can you even just do like 10 minutes of walking, 20 minutes of walking, something that simple? You don't have to really work up a sweat necessarily?
Exercise, we can think about exercise in 3 main groups too. So first of all, it's just being active throughout the day. Trying to sit as little as possible, taking the stairs instead of the elevator, and then structured exercise. Okay, so that's what you alluded to. Any little bit will help. Ideally you want to get up to at least a 30-minute exercise session, at least 5 days a week. But if you even do 10, 15 minutes, you will still get benefits.